educate daters and say, you know, by the way, if you're kissing someone, there is a percentage that you might walk away with something that you did not.
High percentage might get infection through saliva. To show them the side effect of this bacteria infection and how it can affect your life.
Hello, Dr. Marwa. Welcome to Ph.D. Hard Talk. Could you please introduce your research and introduce yourself to the audience at home?
Yeah, first of all, let me thank you for having me. It's a great opportunity for me to have a chance to exhibit my PhD dissertation and discuss my thesis with you, which mainly talk about Helicobacter pylori infection. I bet that most of you haven't heard about this bacteria before, but this bacteria is very interesting. It's a gram-negative pathogen. It can survive in highly acidic stomach environment, and it's widespread all over the world. And it's causes chronic gastric inflammation and cancer. And this chronic infection make its prevalence increase with age in all population, and also it's infecting more than 50% of the world population. And also it has been classified as a type 1 carcinogen since 1994, and it's also been implicated in increasing the risk developing gastric cancer, which is the second most frequent cause of cancer-related death. So let me talk about it briefly. I have this picture here to show you. This is how it looks under the microscope. You can see here it has head and tail, and it has many valence factors to invade our immune system and colonize our stomach. One of those factors producing large amount of urease enzyme. This to make H. pylori organism make it uniquely adapted for survival in the hostile environment of our stomach. So it produces large amount of urease, and this enzyme catalyzes the breakdown of urea to alkaline ammonia and carbon dioxide. And through this reaction, the bacteria may protect itself from acid injury by surrounding itself with alkaline material. And we can see here that this is the spiral structure. This is unique also for Helicobacter pylori, and with flagella, it's enabled the organism to burrow through the gastric mucus layer in our stomach. And after penetrating the mucus layer, H. pylori able to attach itself to carbohydrate and spangle a bit on the luminal surface of the gastric epithelial cell of our stomach cell. So that's why in my PhD dissertation, I discussed the biochemical effect of Helicobacter pylori on immune stress biomarker. And we found that Helicobacter pylori infection associated with increase in immune stress marker like anti-double strand DNA, anti-nuclear antibody, and immunoglobulins such as IgM, IgA, IgG, IgE, which are associated with autoimmune diseases. And also, it's increased the interleukin 2, interleukin 6, C-reactive proteins, and cortisol level as well. So we can estimate here that Helicobacter pylori is probably responsible for immune system disturbance and autoimmune disorder. And also we found that H. pylori infection associated with autoimmune diseases such as lupus, rheumatoid arthritis, idiopathic thrombocytopenic purpura, autoimmune gastric atrophy, autoimmune thyroiditis, and other autoimmune diseases and autoimmune disorders. So we found also that H. pylori may have direct neurotoxin effects that lead to alternation of the brain-gut axis through activation of neurogenic inflammatory processes, increasing cortisol and adrenaline, which may lead to mental disease also, like depression and other diseases. And also because it affects the gut-brain, the brain-gut axis, it also affects the nervous system. which cause new endocrine and immunological reactions,
Mhm.
which may affect your appetite, which in return will affect your body mass index and may cause weight loss for the patient. So H. pylori, we have to handle with this bacteria seriously, because we can estimate also that it's connected with the increasing the risk of metabolic syndrome.
Mhm.
So we also indicate in our result that it increased the risk factor of metabolic syndrome. And also the very important thing that it might cause allergic disease.
Okay.
And IgE hypersensitivity, because our gastric mucosa acts as a barrier against the antigen came from the food. And H. pylori infection destroyed this barrier and destroyed the stomach cell, thus increase the flow of food antigen passing through and increase the possibility of allergic reaction.
Okay.
So our results shown an association between H. pylori infection and increase the allergic sensitivity and allergic reaction. Also, we found that the Helicobacter endotoxins affect the liver function, which cause liver dysfunction.
Mhm.
This liver dysfunction leads to hyperproteinemia, because liver is responsible for producing protein.
Mhm.
So it will impair the liver function because of its endotoxins and cause hyperproteinemia and other diseases, and cause affect the function of liver, which lead to many diseases. And also the strong immune response of H. pylori enhanced by those toxins produced by H. pylori will increase the interleukin-2, interleukin-6 C-reactive protein, and all of them are plays a key role in the pathogenesis of atherosclerosis. That is an underlying cause of coronary heart disease.
Right.
So yeah, we have to be careful, and we have to discover a permanent cure for this disease, because the complication may lead to serious disease such as liver disease, coronary heart disease, and allergic disease, autoimmune disease.
Mm.
So also it affects the insulin resistance and cause hyperinsulinemia, because it affects the metabolism of pyruvate and lactate, which is glucose in our body, which may make, if you diabetic people go through more complication situation. So also Helicobacter pylori infection will reduce cytokine. Our body produces cytokine in response to any inflammation happens in our body.
Mhm.
So continuous cytokine production has harmful effect on our body, like making hypotension, intravascular thrombosis, pulmonary edema, even hemorrhage. So it's this inflammation will affect our immune system, which in return make many other symptoms and diseases. And also it affects the lipid metabolism. And I did my master's degree and master thesis was talking mainly about biochemical changes associated with Helicobacter pylori infection.
Amazing.
And also we found a correlation between H. pylori infection and anemia. Actually, it caused anemia because the Helicobacter pylori damaged the stomach cell.
Mhm.
And in the stomach cell, we have a parietal cell. This parietal cell is responsible for producing intrinsic factor. This intrinsic factor is responsible for absorb vitamin B12 from food. So if there is no intrinsic factor, we cannot absorb vitamin B12, which leads to vitamin B12 deficiency, which is called pernicious anemia. And also we cannot absorb iron from food as well. So it will lead to many other types of anemia. And also I found that it increased the level of ammonia and amylase, which may cause pancreatic disease and affect also the liver function. It affects the lipid metabolism, which increase the level of lipid profile in our body, which may lead to coronary heart disease and ischemic heart disease, and also cause insulin resistance and increase the hyperinsulinemia in our body. And so it's really interesting bacteria and cause many really serious problems we have to deal with.
Oh, wow. I have to say this bacteria, and I don't mean this in a bad way, is providing jobs for people because, you know, people need to work.
Yeah.
So, in a way, it's...
You hit the point.
Yes, it's terrible, but it's providing employment. So, you know, it's a good thing in a way.
Financially, it's good.
Actually, I can see what's going on here. So to ask really, you know, I've listened to your expertise and knowledge, and I'm just wondering in terms of your thesis and, you know, the passion behind your research, what pushed you to focus on such a bacteria? Like I said, you know, if I was a business, I'm thinking, brilliant, I can make a lot of money. If I can hire the right people, that's where the money is.
I will spread H. pylori all over the world, right? So I can produce more medicine, I get more money.
That's it. So what's pushing you to look at such a bacteria?
Actually, I love medical field. I love the cellular level or the function of everything in our cell. It's very fascinating and interesting, and I found that the more I searched, the more I found, and it's very complicated, and it makes me full of
Happy?
energy.
The smell of bacteria is terrible, though. We have to agree on that.
No, actually, it's about the information that you get.
Okay, the information. Yeah. Excellent. So in terms of your methodology then, what made you choose the methodology for this research? I mean, you've talked about your master's, and I'm sure at that point you got really passionate and you're thinking, I need to do this at a PhD level. So what made you think about the methodology, the way you've chosen it, and what is your methodology for your research?
Because I didn't notice that I figured that there is a connection between the H. pylori infection and our immune system. Mm-hmm. And nowadays, immunity is, I think this is the science of the future. Mm-hmm. Because you know, they found many cure for especially for the cancer. They found the last Nobel Prize was about the checkpoint inhibitor, which means that you will once you find this checkpoint inhibitor, you can make your body invade the pathogen. You can alter your immune system to invade this pathogen. Mm-hmm. You can make your body kill this pathogen by this checkpoint inhibitor, which is very interesting. So I thought that I can figure a way to connect between the immune system and how can we make our immune system fight our pathogen, our bacteria. Just find the proper way, find the tool, find the technique. For me, in my mind, I'm thinking about using nanotechnology mm-hmm. to apply treatment for this bacteria and find permanent cure for this bacteria. So because of this term, nanotechnology, immunity, checkpoint, this inspired me to make more researches about this field.
Excellent. So I heard you talking about, you know, for example, allergic reactions, for example, IBS, anemia, all that stuff. So I'm now looking at it from a gender perspective. When you were looking at the data, did you realize that, for example, females suffered more than males, or was it on the same level?
No, for anemia, for sure, the females suspected anemia more than male because they have, you know, menstruation, they lose a lot of blood monthly. That's why they suspected more to having anemia more than male. besides Helicobacter pylori infection, it promotes anemia, infection in people, whatever. And there is there is what there is analytical statistics talk about spread the spreading of Helicobacter among population.
Mm-hmm.
It's increased more in African people than Asian people.
Mm-hmm.
So they're still making study related to this point.
Okay. Now I was going to move on to ethnicity as well, because as maybe people don't know, but usually when it comes to ethnic minorities from, well, not ethnic minorities because that's their continent, Black people from Africa, they tend to suffer from anemia and lack of vitamin B plus.
This is really related to genetic.
Is it?
Yeah, I think so.
I don't know. This is not my field.
Because they are sharing the same genome, I think.
No idea. Right. So in terms of your research, then you've gone through, the symptoms per se of the bacteria and how catastrophic it could be. So if we look at a country like Kuwait, for example, what does the data say when it looks at this bacteria in Kuwait? Is there a high percentage of people that suffer from this bacteria, or is it still at infancy stage whereby we're still trying to understand the impact and we haven't got enough data from a hospital perspective?
Actually, in the Helicobacter pylori infection decreased in developed countries. And but in here, I think we have a lot, because it's the mode of transmission based on oral, fecal oral, gastro-oral, also sharing bed with siblings, they can get this infection. And so the people not aware enough about how to deal with this bacteria, how to avoid getting infection. So I think we have high prevalence factor here in Kuwait.
Okay, so now I'm thinking of communities whereby poverty is a thing, and they all share the same room. The mother and children. Is it a high percentage then in those situations?
Yes, sure. Hygiene is very important to avoid this infection, and also sanitation mode and also the what is called, sanitation mode and hygienic system. This is very important to avoid this infection.
So now I'm thinking of the youth, because they're the ones who exchange orally a lot more. And by youth, thinking anyone who's single up to the age of 55 or 65, and they tend to go out on dates and they're kissing. Is that a form of oral contact as well?
Sure, oral, yeah. Yeah, sure.
And how do we educate daters per se and say, by the way, if you're kissing someone, there is a percentage that you might walk away with something that you did
not. A high percentage. Yes. You might get infection through saliva.
So how do we educate them?
To show them the side effect of this bacteria infection and how it can affect your life. And this is, before doing that, at least make a urea test to be sure that you don't have Helicobacter pylori.
I mean, that becomes a job on its own. It's like, okay, I'm dating, that's a job. Now I have to be testing you before I can kiss you. Woo! That's adding on to the job. And then there's other tests as well that you need to do to ensure, from the blood. And that's a lot of work. It's like, we'll be scared of other human beings now.
But at least be aware that you might get infection by saliva, by contaminated food, because it might also transfer through food, dairy products.
So really don't share glasses when you're drinking, and don't share food.
Sure, yeah.
When someone bites it, don't bite it at the end.
Exactly, yeah, because you might get infection.
Wow. Okay, I need to literally, I'm going to reflect on my life when we finish this conversation because I just share fruits and I just never think about it. It's just a thing. So, in terms of education, then, since we're still discussing education, are you planning on going to schools to educate the younger generations about, contact hygiene, etc., linking to, this bacteria and the side effects? Not now, maybe in the future. Is that something that you're thinking about?
Sure, yeah, it's a good idea. If I have a chance, I'll do it, sure.
Yeah.
Sure, yeah.
So, in a way, right now, if you had to think of a sentence to say to the younger generation, someone might watch our conversation today, what would you say to them to bring awareness of the consequences of this bacteria?
Yeah, aware about what you are putting in your mouth because it may reflect your life, affect your health. So be aware.
And you may end up 6 foot under, literally.
Yeah,
Wow.
yeah.
Okay, that's dire. You've terrified me. I will not be sharing my food
Unless you make a test.
until I get that test done. And even then, I'm still terrified. So I'm still terrified. So in terms of the next steps, then, what are your plans with your research? When you've got the findings and you understand a bit better. I'm not saying you don't understand now, but when okay, a cure, we can find it. What are the next steps?
For now, they are using the triple treatment, which is through antibiotic and proton pump inhibitor like omeprazole, pantoprazole, which decrease the acid secretion, and they moved into the second step, which using quadruple treatment. This just to avoid the bacteria resistance. But for now, it's recurrent. There is no permanent cure. So I hope that I can find a permanent cure for this one. Not only by using medicine, but as I told you, I can use nanotechnology to apply a cure to apply treatment for this infection. So I hope that I get a chance to make a postdoctoral scholarship or do more researches talking about how to apply a nanotechnology to find a treatment for this Helicobacter pylori infection.
Okay, so now I'm in the current situation, which is our current global pandemic, which is the COVID-19. And you've explained about the bacteria. So if somebody already suffers from some of the symptoms that the bacteria causes, does that mean that, if they catch COVID-19, they're at a negative detriment, that their chances are they will not survive, or will they? Yes.
You mean that when he had two together?
Yeah.
No, it doesn't affect maybe, okay, it weakens your immunity because Helicobacter pylori and COVID will decrease your immune response. So you will get more complications because of, if you had COVID and you already had Helicobacter pylori, your body become weak, so it can colonize more your stomach, make more. It can, because it causes ulcer in your stomach. It can make more. It makes severe ulcers, chronic and severe gastritis. But there is no link between both of them. Both of them affect your immune system. So if you had a strong immune system, you can fight both of them.
Okay, so essentially, what you are saying is that if your immune system is already weak and you catch COVID-19, then obviously it's a balancing game. Same as having this bacteria, your immune system's already compromised, and if you catch COVID-19, it means that it is compromised even more. So therefore, it's not the bacteria they themselves that get married. They're actually different in terms of their function.
Yeah, the COVID virus, while Helicobacter bacteria.
Yeah, no, that's perfectly fine. So in terms of advice then for somebody who's really excited and they've just done their chemistry, physics and maths and they've heard you talk, what advice do you have for them and they want to follow in your footsteps? They've got the passion, but they're not sure in terms of how to start or where to start from. What advice do you have for them?
First of all, you have to put a goal for your life. You have to make a plan within next 5 years, what you're gonna do within this next 5 years.
Mm-hmm.
So you have to write it down your goal, what you're gonna do, whether preparing your master, preparing your PhD, and participate in scientific researches. Just put your goal and then go ahead searching for the appropriate tools that will help you to reach your goal.
Okay, so what if somebody has set their goals for 5 years and life has happened? You know, we know that sometimes there's so many oxymorons in life and they feel like every time I write my my list, it never comes to pass, and I'm giving up now. What advice do you have for them?
Never give up. You have to be strong, to make determination to reach your goal. Never let anyone let you down or any circumstances stop you. Don't remove any obstacles from your way and you will reach your goal definitely, for sure.
Definitely, I like that. So in terms of advice then for somebody that's thinking, should I get a scholarship or pay for my PhD myself, what advice do you have for them?
For me, no, it's better to get a scholarship, and there is a lot of scholarship all over the world.
Mm-hmm.
Make a search, you will find many scholarships, and scholarship is better because it's hard to make your PhD by your own, but when you're involved in a scholarship, you can reach higher education, you can reach you can move all over the world, you can see new people, participate with the new scientists. So it's better to get a scholarship for PhD or even for master.
Okay, so I mean, I've spoken to a lot of people, and some people have said that it proves quite challenging if their parents are at an age where they need to look after them to relocate, and sometimes to find a scholarship in their home country, it's difficult. What advice do you have?
It's difficult. You have to travel.
So what if they can't because they have to look after their parents? Like, what's the compromise?
You have to leave your parents in somehow.
Okay, let's flip it to spouse then. You would you leave your spouse and go to a different country? I love you already. But
I hope so. I hope that they have the chance that I didn't have.
Yeah, but we have to cater for people, because I've spoken to some of my colleagues and they do say, I can't leave my partner behind. We have to go together, and if we can't, then it's not for me. And it's nice to hear that you're saying, well, I'll go, maybe he can follow me, or we can go together, whichever way. So
you can compromise with your partner to. You will never move. You will still in your place. You will never go on without just push, try to discover the world, be brave, go, but don't stop yourself.
That's it.
Don't limit yourself.
Okay, I like that. I'll take that on board as well. I'm learning from you. I am learning. So then I have a question to ask you. Why come on PhD Hard Talk? What made you think, do you know what? I want to go and discuss my research?
Because nowadays people not caring about the researches, scientific researches, and how important this research to our life and to our civilization.
Mm-hmm.
That's why I think that this is a good chance, not only for me, for all researchers to explain themselves, since we are now dealing with media all over the world, and this is the most important thing we have. So this is the quick access to every house, to everyone, by sharing your idea through YouTube or through videos.
Okay, thank you very much. So in terms of your research then, you've done it by yourself. Are you open to collaborate with somebody from a different discipline to ensure that you've covered every aspect? For example, someone from psychology, which is
Yeah, sure.
humanities
Yeah.
department, from a psychological perspective or sociology, is that something that you've thought of in terms of publications, or you haven't made that
Perfect.
decision yet?
It would be perfect. Yes.
I love it. It's like,
I
yeah,
love your idea.
it'll be quite interesting to understand in terms of the psychological impact on that individual once
And
they
as I
come
told you,
back.
it affects the brain gut axis, which cause mental disease like depression
Yeah,
and other disease. So we can take this link and make more researches about this thing.
yeah. Do you know what would be interesting though? To look at employees at senior level who suffer from the bacteria, have to make decisions that impact everybody in terms of organization and all their employees, and still have to come into work and be 100%. That would be interesting, wouldn't it?
Yeah, sure.
It's like, I think I think that would be fun. So in terms of your parting words then, to the audience at home, what words do you have to share?
Yeah, encourage them to don't stop, follow, chase your dream.
Uh-huh.
You will reach your dream at the end, but never give up. Don't waste your time by using media, Facebook, TikTok, and this is wasting your time, wasting your life. You'll never reach your dream. You will never reach your goal. So work, you have to work hard. You have to work on yourself so you will reach your goal, or your life will be useless.
Mm. Okay, so in terms of publications then, what have you published that you would like people to read about when it comes to your work?
The effects of Helicobacter pylori infection, which, as I told you, which cause anemia and also affect the autoimmune disease, especially the people infected with autoimmune diseases like lupus, rheumatoid arthritis. I advise them to read this publication and make Helicobacter pylori test with their blood test or breath test, stool test, to be sure that you don't have this one, because it will compromise your immune system. And for those who are suffering from autoimmune disease, they need to improve their immune system so they can fight anything.
Okay, so in terms of, I know that here we've got the NHS. Do you work with hospitals there to ensure that, you know, the education in terms of community drop-ins is spread out and everybody knows about the condition and the effects of the bacteria, or are you still working on that?
No, I hope to get a chance, as I told you. If I get a chance, for sure, I wouldn't hesitate and I will go and give them advice about this one.
That's your action plan for 5 years. So I'll call you in 3 years' time.
Yeah, I love it. Yeah, I love your idea. Yes, I will put it in my checklist.
Yeah, because you know,
Sure.
for example, I know that, you know, for cancer patients, they have drop-ins, isn't it, to educate you as the family, to say these are the symptoms, this is what's going to happen in the first 6 months, 3 months, 1 month, and finally. So I feel if there is such a community hub where individuals can go, whether online or to walk in, and they are educated, I feel from a global perspective, it will help a lot more people, specifically if it's on the internet, because I can go in and read and then reshare the article. So it goes around really quickly. If it's a blog.
Yeah, I love your idea and I will work on it. It needs plan, good policies, procedures to deliver as much information as you can to the people and guide them.
Yeah, and now they can watch Ph.D. hardtalk and then a bit more as well. And hopefully the details will be at the bottom of the screen in terms of the links for the publications. I think there's 2 publications. And are you going to be speaking at any conferences soon?
No, for now, no.
Well, when you do attend a conference, we'll share it as well. to say that.
Sure, I will share it with you. Sure, for sure.
Yeah, definitely. Now, it's been an amazing chat. I feel like we've discussed a lot. How do you feel?
Feel great because I love your ideas. I love guiding me to new ideas. Thank you very much.
Well, thank you very much, Dr. Marwa, for your time today. It has been amazing, and I feel like I've learned so much. I've never understood bacteria, but I feel today I understand a bit more in terms of the side effects and how it can impact my mental well-being. And I feel in the world that we live in, we need to be educated about, the different forms or systems that can affect our mental health. It's not just verbal abuse or manipulation or just the environment. There are other factors. So thank you very much for sharing from a medical perspective. So that was very, very enlightening. Thank you.
Thank you very much. Thank you.